jab, you may have waited more than a month or 2 or 3, and you're waiting for the second or other consignment of the vaccine to come. But also many that have not taken are asking this question. Now, Uganda has basically used the AstraZeneca vaccine, COVAX as we call it, and the recommendation is that within 4 to 12 weeks. And Uganda has been doing 8 weeks, and we can actually push it to about 12 weeks. It is really fine, either of those. Now, of note, taking it too early may not be so helpful because your body needs time to use the first shot of the vaccine to generate the immunity that you need. So that the second that you take will be a booster dose. So the answer briefly is 8 to 12 weeks. And the reason that you're doing that is to give your body time to actually generate the immunity to face the virus in case you get it. And the second question is really very related to the vaccine. Can I contract COVID-19 even after my 2 jabs? The answer, straightforward, is yes. It is no wonder that in countries that have managed to vaccinate way more people than now in Uganda, the mask is mandatory. Social distancing is still mandatory. And hand washing, workers, vaccinated as we may be, and using sanitizers, we are still wearing the mask. So you can't, everywhere the vaccine is being pushed for, is that you actually get strong protection against severe disease. In essence, you can actually contract the virus and walk around with only mild symptoms, if any. Or in case you get that sick, the chances of dying from the infection of COVID-19 are actually minimized. We must understand that you can actually have the infection, but not symptoms or the disease for that matter. And this is common with just about infection. There are those that walk around with a common flu and they may transmit it to another person, but without them having any symptoms. In fact, some people carry malaria, but they don't have symptoms from it. And this is what the vaccine confers to you. The chances of getting very severe disease and dying from COVID are actually minimized. So it isn't true that in the UK or Israel or China or the US there is no COVID. It is there, but the people have garnered enough immunity to fight off the severe disease that may follow infection with the virus. Women, and Joseph here is asking, are pregnant women or breastfeeding mothers, for that matter, allowed to have COVID-19 vaccine? The straightforward answer again is yes, they're allowed. And in fact, they stand to benefit because especially pregnant mothers, we've known for a very long time that their immunity is reduced so as to keep the pregnancy. It is what we call a physiological adaptation to the presence of another human being inside the body. So the body tones down its immunity, and conditions like COVID may actually have the chance to cause more severe disease to the pregnant mother. And so she's among those that should actually get vaccinated first. And so that confers the immunity and again protects her from very severe disease. Plus also she's a member of a family that still needs, and we had known COVID to only attack people that are older, 60, 70 plus. But as we have known, protecting this mother is going to protect first herself and the baby unborn inside her, but also when that child is born, if the mother is protected from severe disease, the baby will equally be protected. That aside, if this mother survives an infection and even death, it means that the baby is protected because the mother will remain there to offer the protection always. Now, Derek, I have lost my sexual urge since I was vaccinated. Is it a side effect of the vaccine? This speaks to so many, and if you're on social media, you've seen so many posts going around. Now, in medicine, there are causes you fail. Erectile dysfunction is a broad subject that has actually been there even before COVID, even before the vaccination. My first advice to fellow men, we shall come to the women later, don't just say COVID vaccine has caused this, because there are so many causes that you could be sitting on. My first advice, please go to your healthcare worker. We have a sexologist, one of them are hosts here. Get in touch with them and get your condition dissected. There may be so many other things actually that are causing trouble, and you could settle your home earlier than just tying this thing on the vaccine. That aside, everyone cares about sexual dysfunction and effect, unless the benefits, as we say, outweigh the loss of sexual dysfunction. And the vaccines have been tested for these side effects, and none has been found to cause this. But we know that COVID itself, actually, in the short term and the longer term, because it affects just about any part of your body, is very capable of causing erectile dysfunction, and this has happened. We must also note that a good number of times you get COVID and it passes without you getting severe disease. So it may pass as anything else, yet in actual sense cause an effect that may result in sexual dysfunction. We also know that many factors actually affect one's sexual function. And you're in such a hard time. Your lifestyle has changed so much. You stay home, you don't interact the way you would. Your exercises have changed or reduced drastically. Your diet has changed so much, and there's a lot to worry about. And you and I know that if there's a lot on your mind, then your sexual function may not be as good as you would wish, or as your partner would wish, for that matter. And so the psychology and your well-being as a person are things that have come so much into not change in this pandemic. Our only hope really is that we can. Are there many other things that can cause the reduced sexual function? Absolutely. And I think you and I should take the chance to look out for these. All right, we are going for a very short break, and we shall be back with many of your questions. You still can interact with us on our YouTube page, Facebook, and Twitter. Our handles are Doc Talk Show. See you shortly.
You are watching the Doc Talk Show. The Ministry of Health informs the general public that amidst the difficult times of the pandemic, routine immunization for all children under 5, those eligible for HPV vaccines, and women of childbearing age is still going on in all our health facilities. Parents and caregivers, take all your children for immunization as per their schedule. All vaccines are safe, effective, and free. Remember to observe the COVID-19 prevention measures as you go for immunization services. Wear a mask properly, covering your mouth and nose. Wash your hands regularly with soap and clean water, or use an alcohol-based sanitizer. Maintain a physical distance of at least 2 meters from others and avoid crowds. This message is from the Ministry of Health with support from partners.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Central Points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go. MTN.
You are watching the Doc Talk Show.
Welcome back. It is the Doc Talk Show, and I'm your host, Dr. Jagenda Joseph Ogavu, and we have dedicated this show to answering your hot questions about COVID. So Miriam here is asking, how do you explain someone who is fully vaccinated dying after. Now, this is very unfortunate, Miriam. Like I said really at the beginning, we condole with all of you, and like I said, there's many of us that have lost someone. Other people will be protected better. Now, there's what we call dying from COVID and dying with COVID. You could also die after COVID. And this is what is actually happening at a time like this. A good number of patients have succumbed to conditions such as heart disease or diabetes, or even blood clots in the heart, in the vessels, and in the lungs, all most likely associated with COVID or as a consequence of COVID. So when COVID attacks a person, it causes a storm, as we have had, and it decimates just about everything. And for a good number of people, especially those that have had stays extending to the ICU, they really live when they are generally much weaker, and the risks of clots actually increase. So a good number of people have died from what we know medically as pulmonary